Good morning, everyone, and welcome to the Holy Cross Health Be Fast for Stroke webinar. This is your moderator, Jamal Clemens, Senior Marketing Communications Specialist for Holy Cross Health. Our speakers today are Nurse Practitioner Sharon Harriston from Holy Cross Silver Spring Hospital, Medical Director of Neurology and Stroke, Dr. Shahid Rafiq, and Senior Nurse Educator Luciana Castro from Holy Cross Germantown Hospital. We've got an informative session for you today where our providers will discuss the different types of strokes and their causes, signs and symptoms of stroke, and effective lifestyle changes to reduce the risk of stroke. After each provider speaks, we will have a question and answer session to address your stroke-related questions. If you have any questions for our panelists, feel free to put them in the question and answer box on your computer. Without further delay, I will turn the mic over to our first speaker, Sharon Harriston.
Thank you, Jamal. As I said, May is Stroke Awareness Month, and during a stroke, 1.9 million cells die every minute when you're having a stroke. And there are different types of stroke as well. The most common stroke, which happens 87% of the time in the population, is called ischemic stroke. And that entails where a blood clot forms in the blood vessel in the brain and causes decreased blood flow to the brain cells and causes an ischemic stroke. The other type of stroke is hemorrhagic stroke, which occurs 10% of the time. And that occurs when a blood vessel bursts in the brain and again causes decreased blood flow to the brain cells and cause major damage. During a stroke, patients can have signs and symptoms of sudden difficulty with walking, sudden difficulty with talking, like saying the wrong word or slurred speech, sudden being able to understand and process difficulty, coordination problems, numbness or weakness on one part or one side of the body, problems writing, problems with coordination, problems with vision, such as double vision or blurred vision or peripheral vision loss, can also occur when you're having a stroke. Signs and symptoms of stroke happens all of a sudden, so don't wait, be fast. The Be Fast acronym stands for B for sudden balance difficulty. You might have some dizziness with that as well, and coordination and difficulty walking. E stands for the difficulty with vision. So if you have sudden, again, blurred vision, double vision, peripheral vision loss, even sudden blindness, call 911 right away.
F stands for facial droop. So if you have face starts to droop on one side, think about stroke until proven otherwise.
A stands for like arm drift. So if your arm is weak and you can't move it and it drifts down, along with you might have, besides the arm weakness, you may also have facial droop, and you may also have leg weakness with the arm weakness. If so, be concerned about stroke. S stands for problems with speech. So as I stated before, you might have sudden speech problems, such as saying the wrong word or having garbled or slurred speech where people cannot understand what you're saying. And then T is for time. Time is brain. You have any signs and symptoms of stroke, call 911 right away. Do not wait. Because again, 1.9 million cells are dying every minute when you're having a stroke. And with men and women, stroke symptoms pretty much are similar. Women might have some headaches with, their symptoms, but you can have the worst headache of your life, whether it's a man or a woman. That's one of the signs and symptoms of stroke too. When you have the worst headache of your life, don't wait, call 911 right away. Some patients might even have seizures but it could be a sign that they're actually having a stroke. Again, call 911. Sometimes people may, depending on the location or the type of stroke, can have even some nausea or vomiting as well. But again, it's sudden onset. Don't wait. Call 911 right away. Ways to prevent a stroke. Well, let me just say common risk factors first. So common risk factors for stroke is high blood pressure. High blood pressure is the number one risk factor for stroke for all races. Diabetes is also a common risk factor, high cholesterol, alcohol abuse, drug abuse, cigarette smoking, obesity, sedentary lifestyle from lack of exercising. Those are the common, stroke risk factors. Men and women are also at risk for stroke. Strokes can happen at any age also. A lot of times people have the premise, it happens when you get old. Yes, strokes does increase as you get older, but strokes can happen at any age. We've seen patients who as young as 18 had strokes. And we've actually seen an increase in strokes in ages of 30 to 60 years old age groups because people are having those earlier cardiovascular risk factors at a much earlier age, such as high blood pressure, diabetes, and high cholesterol. I just lost it. Ways to prevent a stroke is healthy lifestyle. So it's all in moderation, right? They recommend that you exercise at least 30 minutes a day or more 5 days a week. So having a healthy lifestyle, eating in moderation, a Mediterranean diet is highly recommended where it has more fruits and grains, lean protein, more vegetables, more fiber to help prevent a stroke. If you have those risk factors such as high blood pressure, diabetes, know your numbers. Check your blood pressure every day. Make sure when you're checking your blood pressure, you keep a log and you review that log with your primary care doctor to make sure that depending on your blood pressure readings, your medicine is working. And if it's not, looking at those readings, that the doctor can adjust your medication accordingly. If you have diabetes, check your numbers, check your blood sugar every day, and depending review that with your primary care doctor so you make sure that the medicines that you're on is controlling your diabetes. Same thing with your cholesterol. Get that checked annually or even every 6 months, depending on your numbers, and partnering with your primary care doctor so you can be the best, healthier version that you can be.
I'm Shahid Rafiq, a neurologist and stroke vascular neurologist. I have board certification both in neurology as well as stroke. I direct the stroke program and neurology program in Holy Cross Hospital since 2012. It has been my passion to develop the programs and maintain the programs. Holy Cross Hospital stroke programs, both in Silver Spring and Germantown, is one of the best in the country. We have many accolades from American Heart Association, and we take excellent care of stroke patients in these two hospitals. So thank you, Sharon, for making us aware about the causes of the stroke as well as the risk factor and prevention. I would like to touch upon the treatment. Before that, I would just add one thing that Sharon has very beautifully stated, the signs and symptoms of stroke. So I would just add that because the signs and symptoms of stroke are so varied, so different, sometimes it is hard to pinpoint that a stroke is occurring. And that's why a lot of patients that we see, they were playing golf, and instead of calling 911, they went home, they slept, thinking that it will be over. They were working or going to work, they completed the work, didn't get better, in the afternoon they came. And the reason is that because the brain controls all functions of the body. And so depending upon which part of the body is affected by stroke, you will have that function lost. So that is why it's not typical. Most people think of just paralysis on one side of the body or speech problem. But it can be any of those which Sharon elucidated to. So for if you want to take one take-home message, anything, any neurological dysfunction that starts suddenly can be a stroke. So call 911, even if it's a false alarm. In the ER, we will let you know maybe you're not having stroke, or so it's better to err on the side of caution and have a higher index of suspicion than to ignore it. So having said that now, the treatment of stroke is kind of, I would divide it into two sections. One is the acute stroke treatment. When you're having a stroke, when you have a stroke, how do we treat it? And then secondly, and most importantly, how to prevent another stroke, because whatever damage is done, we cannot do much about it, although we'll talk in the acute stroke treatment section. But short answer is that damage is done. So the best treatment for stroke is prevention of another stroke, which is going to happen because it becomes a risk factor. Once you have a TIA or stroke or mini stroke, you will have more chances of having a stroke, but you cannot do anything about it other than to do treatment for modifiable risk factor, controlling the modifiable risk factor. Having a stroke in the past or family history of stroke is not modifiable. You cannot do anything about it. You cannot reverse your age because age becomes a risk factor after 65 years of age. So when you come to the ER, there's two, again, acute treatment for stroke. One is in the ER. What do we do in emergency room? And then second is when you're admitted, what do we do in the next 24, 48, 72 hours while you're admitted? So when you come to the ER, the first question we ask you is, what is the last time known well? So that is very important that you should come up with that information. If you're thinking that you're having a stroke or your loved one is having a stroke, just think about this first question that will be asked in the ER. When were you totally fine? When was the last time known well? So for example, if you wake up at 7 o'clock in the morning and you have this problem, and when you went to bed at night, the prior night at 10 o'clock, you were fine. So the last time known well is 10 o'clock last night, not 7 o'clock when you woke up with the problem. So that is very important in our calculation, that you fall within the window of a certain treatment. Now we do TNK. Previously we did altiplase, now tenecteplase, but in the same family. It's a TPA, and we give you that injection only if you come within 4.5 hours. So we also logistically take half an hour to 1 hour. So definitely within 3.5 to 4 hours. If you hit our ER or any ER, we will give you that injection if you qualify. Now, what do I mean by qualification of that? So there's an inclusion criteria and there is an exclusion criteria. So you have to be an adult having this problem, and exclusion is you should not be on a strong blood thinner like anticoagulation, like Coumadin or Eliquis or those kind of things, and you do not have a history of bleed in the head, or bleeding at this point or recently in a week or two or having a major surgery in a week or two. All these, but don't worry about those details because we will take care of that. We will look at the checklist. We will look at the inclusion and exclusion criteria each time you come, each patient that come, we do that. So we have a checklist, so we are going to do that, so you don't have to memorize that. I was just mentioning some of those. But after we determine that you have come within 3 hours, then we give you that injection. If you come at 4.5 hours or 5 hours, you miss that window. So that is why it's so important to recognize the sign and symptom of stroke, like Sharon mentioned, be fast. You absolutely need to know for yourself and for your loved one and call 911 because time is of the essence. Time is brain. You have to save your brain, and there's no faster way than calling 911. You cannot drive to the ER. You cannot call your son or daughter or friend to help you. No, call 911. So now you're here in the ER. We will determine whether you fall in the first window. Now, what is the second window? Second window is up to 24 hours. But that is only for a major stroke, meaning that happens with a clot or bigger clot in the early vessels, like as we branch out in the vessels. And that kind of stroke is severe. So NIH stroke scale that tells us the severity of the stroke is more than 6. So then we determine that whether you qualify for it or not. So that also you don't have to worry about. We have the checklist. We know the inclusion and exclusion criteria. We will go through with that. There's an ER physician there in the ER and a neurologist either in the ER or on phone. And together, ER physician and the neurologist make that decision and determination whether you fall in the first window or second window or both windows and treat you accordingly. So all you have to do is to recognize the stroke sign and symptoms, call 911, come to the ER. So that's the ER treatment. Now, either way, whether you miss a window or other disqualification that you could not get the TPA, if you get that injection or procedure, thrombectomy, then you get admitted in ICU for 24 hours because we want to really monitor you very closely because one of the side effects of this injection or treatment, clot buster treatment, is that you may bleed in the head. So we monitor you 15 minutes, every 15 minutes, then every half an hour, then 1 hour, and you need to be in ICU for 24 hours. And then we do the CT scan to make sure that you did not bleed. So all that is if you get the injection. If you did not get the injection, then you are admitted in what we call our stroke unit. In Silver Spring, it's on 6th Southeast, and in Holy Cross Germantown, it's 5th floor or 4th floor. So now you're admitted, and then we have to maintain your blood pressure at a higher level. This is kind of counterintuitive. Most people think that the blood pressure should be controlled. Yes, ordinarily it should be controlled, but in acute stroke state, don't be surprised that if the doctors are maintaining your blood pressure at a higher level, because the brain needs that flow, the blood flow, the oxygen, to save the brain, save the penumbra or salvageable brain. So that is one thing. Then we'll give you fluids. We determine whether you can swallow or not. We do the swallowing evaluation. We do the physical therapy, occupational therapy evaluation. We check your blood risk factors. You have high cholesterol, diabetes, and weight, obesity, like Sharon mentioned, all the risk factors. We determine all that within 24 hours. Through the blood work, then we check your vessels, the arteries, and then heart with ultrasound or MRA, CTA, all that to make sure that we prevent a future stroke as well as stabilize you within that 24 to 48 hours. So once that is done, then you'll be discharged according to your deficit, either to home with physical therapy, occupational therapy, or subacute rehab in a nursing home, or acute rehab where you have extensive physical therapy. If, like Sharon said, that there are two types of stroke, hemorrhagic and ischemic. So I told you about the ischemic stroke, which happened with the clot. But other type of stroke is a bleed in the brain. So that would be different. We admit you in ICU. Here we treat you with a low blood pressure. We have to control the blood pressure right away and bring it down below 150, 140. So that treatment is a little different. But again, all you have to do is to come to the ER right away, calling 911, and we will take care of you. And as a general public, you need to familiarize and memorize your stroke sign and symptoms and calling 911. Over to you, Lucy.
Thank you, Dr. Rafiq and Sharon. So you may have a question like what happened after a stroke. So as Dr. Rafiq mentioned, we offer to our patient acute care rehab. So during your hospitalization, a physical therapy, occupational therapy, and a speech language, they will come and do the assessment and see how you are doing. So after the recommendation, with the team, with the interdisciplinary team, including the case manager, social worker, they will decide where is the best place for you to go. So you can go an acute care rehab center, you can go to a long-term center, a nursing home. You can go home also with some physical therapy, occupational therapy, because we wanted you to go back as much as possible, as normal as you was before having the stroke. So doing a rehab very intense is going to keep you as more healthy as you can be. So this is why we always recommend to change your lifestyle, eating better, exercise, know your numbers, like Sharon mentioned. It's very important to know your number, blood sugar, cholesterol level, hypertension, and also talk to your providers. That is very important. So from here, from the hospital, you will go to different places, depending on the level of your need. That is when you're going to get better. And also, we wanted to emphasize be fast and rápido. Also for the Spanish speaker, we always remember rápido. Para aquellos que hablan español, siempre hablamos de la palabra rápido. Son todos los síntomas del stroke. Entonces, cuando hablamos de la palabra rápido, la palabra rápido significa la letra R, es para cuando tenés el rostro caído. El rostro caído ya sea del lado derecho o del lado izquierdo. La letra A es para cuando uno tiene una parte del equilibrio que no tiene el balance adecuado y se va para un lado o para el otro. Después tenemos la otra palabra de la letra P, que significa la pérdida de la fuerza, ya sea del brazo derecho o del brazo izquierdo o de la pierna derecha o pierna izquierda. Después tenemos la letra I, que es del impedimento visual, cuando tenemos un cambio en nuestra visión que no podemos ver claramente. Y siempre recordemos que son esos cambios abruptos, esos cambios que pasan de repente. Después la letra D es para la dificultad de hablar, ya sea que las palabras no pueden ser pronunciadas correctamente o que también no podemos hablar del todo. Y después, por último, la letra O es para que obtengamos la ayuda lo más rápido posible. Llamemos al 911 y tengamos la ayuda necesaria en el hospital más cercano. Entonces, por favor, recuerden la palabra rápido.
Wonderful. Thank you all for your expertise. We have a number of questions from our audience. So it kind of runs the gamut from what y'all have been talking about this morning. One of the questions is if someone could speak a little bit about the types of stroke. I know Dr. Rafiq, you were talking about, that there are mini strokes and sort of more, sort of larger strokes as well. And then so the question is if you could go into that a little bit more. And then there's a question, if someone has a mini stroke, is that as serious as maybe something more drastic?
Right. So the stroke, the types of stroke actually basically is hemorrhagic and ischemic. So again, these are medical terminology. Ischemic means that the blood supply to a particular organ is diminished or prevented or failed. So that can happen to heart or kidney or any organ or tissue when the blood supply is blocked. So that's ischemia. And infarct is the death of that tissue because of the lack of blood flow. Now, when it happens to the brain, it's called stroke. So a vessel, a artery that carries the blood and oxygen to the tissue is blocked by a clot, or the artery itself gets narrow and then narrow and narrow, and thrombotic, it blocks that way. Or a clot comes from the heart and impacts that vessel and blocks the blood flow. So these are all examples of how cardioembolic coming from the heart or coming from another artery or artery blocking itself. So end result is that oxygen is not reaching that intended destination, and as a result, that part dies. So that's an ischemic stroke. Hemorrhagic stroke, on the other hand, is when the artery gets burst. So the blood leaks out, right? So when blood leaks out of the vessels, again, it will not be reaching the intended destination, and that part will die. And that's a hemorrhagic stroke. So end result is the same, but mechanism is different of death of a part of the brain. And the treatment is different. Now, mini stroke or TIA is a totally different thing. TIA is an acronym, stands for transient ischemic attack. So it's transient, meaning that it's reversible. It was an event, and it resolves. Ischemic, like I described, it is a lack of blood supply and oxygen to the tissue of the body. And attack means that it's an event. So stroke is permanent. When a part of the brain is damaged or dies, that deficit is permanent. Although it gets better, but it will never come back to 100%. On the other hand, TIA is an event. It's a reversible stroke, meaning that the stroke was going to happen, but the problem resolved, and the oxygen supply and blood supply restored, and before that part of the brain died, it revived. So there's no permanent deficit as a result of that. So it's a misnomer. I don't like this name mini stroke because it says that it's a tiny stroke. Tiny stroke is different than a mini stroke because mini stroke, the TIA is not actually a stroke. It's an event. Now, how serious it is as serious as a tiny stroke. So minor stroke and the TIA are both as dangerous as a big stroke or major stroke because they are kind of a red flag, a warning sign that a big stroke can happen at any time. So you're lucky if you had a TIA and you were not listening to your primary care physician or not paying that much attention to your health and risk factors for stroke, and now, the fate, you got the warning. And now you can really pay attention so that you do not get a stroke. So it's as serious because TIA can result in a stroke. In the recent future, in 48 hours, in 1 week, in 3 months, the risk decreases after 3 months, but it's highest in the first 3 months.
Thank you. This next question might be for Sharon, but it could be for anybody. We got a few questions about stress being a factor for the causes of stroke. So perhaps somebody could talk a little bit about the importance of stress management and just how stress contributes to strokes.
Sure. Thank you for the question. Yes, stress does, play a part and can be a stroke risk factor. But stress can also just be a risk factor for different health issues, such as, heart attack as well, besides stroke. Stress can increase your blood sugar, your blood pressure as well. The best ways, because everybody deals with stress differently, and the best, ways or good ways to help manage your stress is whatever is stressing you out, change that to help decrease your stress level. But you also can go like exercising besides, losing weight and just help create a healthier version of yourself. Exercise definitely helps decrease stress. Typically after exercise, you should feel much better. Your stress should be relieved or certainly decreased. So I highly recommend exercise because that's what I personally use to help decrease my stress level. And then looking at different activities that can help decrease your stress level. Like some people like to write, some people like to draw, some people like to paint. If you're, a religious person, going to church, for example. I know that's my other personal way of helping decrease my stress level. Doing just fun activities. I know work right now is just, very busy and challenging for, all of us, but making sure you have some downtime. Once you finish your job on the weekends or whenever you off, go get that massage. Go to the movies, go out to eat. When you're more stressed, it's also because you're not getting enough sleep. And, they recommend that you get at least 6 to 8 hours of sleep a day. So getting enough sleep does help decrease your stress level, and it's, overall more healthier for yourself as well. I don't know if Dr. Rafiq and Lucy, if y'all have any other thoughts about that?
The stress indirectly can worsen your diabetes, can worsen your cholesterol levels, in particular high blood pressure. So high blood pressure is by far the number one risk factor for having a stroke. And so stress definitely can cause that, and also variability in the blood pressure. Sometimes it's high, sometimes it's low, sometimes it's high. The spikes in the blood pressure will damage your inner lining of the arteries and blood vessels and cause the atherosclerotic plaques that further then cause the stroke. So definitely relaxation is an active process. So you have to schedule that time. Otherwise, it won't happen. It's not passive. It's not like, oh, you don't have anything now, so you're relaxing. No, you may be very stressed out that what am I doing with my life? So setting aside a time for that activity, like Sharon said, that relaxes you, music or religion or gardening or book reading or sightseeing, traveling. But I would add that exercise is one of the biggest de-stressors. So when you exercise, you're killing two birds with one stone, meaning that you're decreasing that risk factor. It's checking the boxes. So one box is lack of exercise. So you check that box. by doing the exercise. But the second at the same time is that exercise, whatever you're doing, relaxes you as well. It decreases epinephrine, norepinephrine, and cools your brain and body and so circulation and all that. So it serves two purposes. But besides exercise, you should, or you can combine the exercise. For example, for me, if I'm on a treadmill watching a half an hour episode of a show or, anything, music or something, will do the double thing. You're relaxing, you're watching a show, and you're exercising. So you can combine the two, or you can separate. Thank you.
Luciana, this might be a good question for you. What does a stroke patient need to do after their hospital stay for the best chance of significant recovery?
Okay, yes, so that is a great question. So first of all, you will be having all this information at the discharge, either from your provider and the nurse. They will do the discharge for you, and they will give you all the information, what happened after you get home or the rehab center when you're going to have your recovery. So first of all, you're going to follow up those directions, checking with your primary care, follow up with the neurology in the clinic, doing your appointments, and also if there is a schedule any physical therapy, you will follow up with that appointment. We encourage always to do at least like a 3 times a week. You will have like that physical and occupational therapy. So it's very important to stick with your schedule. And you always call back. It's always a number. You will follow up with your provider and, of course, the neurology.
Awesome. Thank you. There's a question here. Could someone talk a little bit about the screening protocols for strokes? We got a few questions about just, I guess, the prevention aspect and the screening portion.
Yeah, so basically, like I said, number one, by far the number one risk factor for having a stroke is high blood pressure, hypertension. So, and most people, they go to primary care physician and there they check the blood pressure. However, I have come across many patients who say, because you went to the office, they took the blood pressure and they said, oh, it's okay. And you did not ask what number is that, right? So I think I would advise strongly that you need to know your number. What is my blood pressure generally? Meaning it could be 115 over 70 or 130 over 80 or 110 over 65, whatever it is, on an average. Obviously, there is a big variation, 5 to 10 points, even day to day, within the same person and between 2 equipments and 2 offices. But generally, you need to know that number. And any time that so this is the key. Anytime a doctor tells you, or you checked it, or somewhere, or CVS, or in a health fair, you checked your blood pressure and it was high. Now is the time to buy this would be a great investment for your health, buy a blood pressure measuring device. Nowadays, they're not as expensive as before, so you may get it in $30 or $40 and have it at home. So because a lot of time you say, oh, I have a white coat syndrome, whenever I go to the doctor's office, it's high. This is your chance to see for yourself that when you're at home, in the morning when you wake up and you're relaxed, and also in the evening when you had a rough day or work day or whatever goes through the day. So those 2 measurements, before breakfast and before dinner, will give you an idea. If you and put a blood pressure log, date, morning, evening, blood pressure and heart rate. So do it for a week and see for yourself those 15 readings or 14 readings What do they say? And every time it's higher than 130/80, circle it. And then you see how many circles you have with, out of 15 readings, how many circles you have. If the circles are more than 50%, more than 7 circles, that's a lot. 1 or 2 circles, not too high blood pressure, maybe, then you do it another week. But if everything is fine for 14 readings, then you can stop it for a while. But if your blood pressure is up and down, and the best way is to monitor it at home and take that blood pressure log to the doctor the next time you see a doctor. A lot of time I advise my patients, and then they come the next time and say, oh, I forgot the blood pressure log at home. If you have that tendency, and if you can note it on an iPhone, or there are apps available to monitor your blood pressure, use them and show that to the doctor next time you see them. So these are kind of things that you really, really have to do so that's the screening number 1. Then cholesterol, I think once a year you can check your cholesterol from your primary care physician. Once a year you can check hemoglobin A1C or blood glucose for diabetes. And weight, you know yourself, like you are overweight, and body mass index should be less than 25. So that's the easiest, like blood. There will be an equipment that weighing scale that you have to buy, but it's also, again, a very good investment. You weigh yourself at home and divide it by the height you have, and that gives you a body mass index. That's the best way. Exercise, you know whether you're doing exercise or not. Sleep apnea, do you have sleep apnea if you're snoring and sleepy during the day? Ask your doctor to order a sleep study. So now we have gone through smoking. You know if you're smoking or not. If you're smoking, please quit. Drinking. Previously they said, 2 glasses of wine for male and 1 glass of wine for a female is okay. But the latest recommendation is no alcohol is safe. No amount of alcohol, no amount of smoking is safe. So please, so now we did all the screening. Blood pressure, cholesterol, and diabetes through primary care physician once a year. Then weight, exercise, smoking, drinking, and sleep apnea. That's all the 8 risk factors.
And if I can also add to Dr. Rafiq, also when patients come in, we screen patients for all those indications, but we also check out your heart as well. We do an echocardiogram to make sure your heart is pumping well, make sure some type of vegetation or blood clot seen in your heart. And then we also do check your heart rhythm as well to make sure you either have normal sinus rhythm, or if you have a regular heart rhythm called atrial fibrillation or atrial flutter. Your heart can get loose, go up to the brain, and cause strokes as well. So that's the other screening that we also do when patients come in, whether it's a TIA, hemorrhagic stroke, or ischemic stroke. Thank you.
Thank you. We have another question about insomnia. This question says, is insomnia natural after a stroke, and can it become a habit if not corrected?
Yes, it could generate stroke or any other illness. So you had a operation or surgery or a procedure or mammogram, and the result is not totally fine, or you're waiting for the result. All these instances can generate a stress or anxiety, right? And that stress can lead to insomnia, difficulties staying falling asleep, and then staying asleep. And that can turn into a permanent insomnia, and that's what we call psychophysiologic insomnia. Psychophysiologic insomnia is a term given to a type of insomnia where it starts with a genuine concern or genuine event that should lead to an insomnia. It makes sense that it would lead to an insomnia, but then it stays, and you are now having a chronic insomnia. So definitely addressing it earlier on, nipping it in the bud, is the key. And also, we know that 40 to 50% of the patient after stroke develop depression. So that would cause insomnia as well, or hypersomnia. It can go both ways, but insomnia can definitely be caused by depression and anxiety after the stroke. So treating those early on, if you're anxious, a short-term anxiolytic, if you're depressed, a short course of depression medicines is not a bad idea. Ask for that or tell your provider that I'm depressed or I cannot fall asleep so that it can be addressed sooner rather than later.
Wonderful. We did have some folks who arrived a little bit after we started. So if we could go around and maybe just give, in a shortened version, just the final highlights or the final things that you would like to leave our viewers with. We'd appreciate that.
Okay, I'll start. So I would just say, don't wait. Call 911 when you're having a stroke. Again, 1.9 million cells are dying when you're having a stroke. So you don't want to wait, because stroke is also the number one cause of disability in the United States. So can you imagine having a stroke and you can't work anymore to provide for your family and have your regular independent life? So be fast, call 911, don't drive, as Dr. Rafiq said, don't wait. Primary prevention is the key for preventing strokes. So knowing your numbers, if you have high blood pressure, diabetes, high cholesterol, know your numbers, take your medicine as prescribed, and follow up with your primary care doctor on an annual or either biannual basis as needed. If you do have a stroke, make sure you take the medications prescribed to you to help reduce your risk of recurrent stroke, because when you have one stroke, you're at risk for having future strokes. So compliance is very important, because you don't want to have a second stroke. Because besides being disabled from a stroke, strokes can kill you also. So be fast, don't wait, call 911, and take care of yourself. Because as best as you can take care of yourself, it will help you have a healthier life. Thank you. Dr. Rafiq?
No, I agree that prevention is the best treatment, like we discussed. And prevention can only be done with awareness of the stroke, both stroke sign and symptoms as well as stroke risk factors. So knowing the stroke sign and symptoms help you get to the best treatment available faster. Because if you miss those signs and symptoms and do not come to the ER or emergency room in time, you'll miss that window where we give the clot buster medicine and clot retrieval procedure. We can bust the clot or try to bust the clot or smaller clot, and we can extract the bigger clot that will cause the stroke and a permanent damage. So both those windows 4.5 hours for the injection, clot buster medicine, and 24 hours for the clot retrieval will pass if you ignore the stroke sign and symptoms. And so BFAST is the acronym for that. Balance and vision problem, and facial asymmetry, arm weakness, and speech problems, and time is brain. You call 911 and come to this ER, nearest ER. They will bring you to the nearest ER. In Maryland, we have a very good system, Emergency Medical Services Institute. MIMS make sure that the EMS and Emergency Medical Services 911 will take you to the nearest certified primary stroke center. So that's for that. The other part is knowing the risk factors for having a stroke is the best prevention. And again, those are high blood pressure, number one cause, hypertension, high blood pressure, high cholesterol, diabetes, smoking, drinking, obesity, overweight, lack of exercise, and sleep apnea. So all of these are and big risk. So in cholesterol, sometimes people say, "Oh, I have, good cholesterol, so I don't need to treat bad cholesterol." That is not correct. You get a bonus point for having a high good cholesterol, but bad cholesterol is bad. So don't try to trick yourself into not doing more, because you really, really want to be very aggressive. I'm very aggressive with my patient in the prevention of stroke. I do not want a single patient under my care to have another stroke or a stroke. So that's why I'm very aggressive in all these, treating all these risk factors. And you should also. This is your body, this is your brain, this is your mind. You need to be aggressive and telling your provider, "Hey, can you please check my cholesterol? It's been 2 years that I don't know what my cholesterol is. I don't know what whether I'm developing diabetes or not. Can you please check the blood work?" Because sometimes, doctors they want to treat their patient to the best of their abilities, but sometimes they get busy and they are treating, you have, say, 6 illnesses, and they're treating all of them. So they may miss here and there one thing. So you are the best advocate for your health. You are the best advocate for prevention of stroke. So please educate like this. So this seminar, I appreciate Holy Cross arranging this awareness webinar. May is the Stroke Awareness Month, National Month for stroke prevention. So we are very happy that Holy Cross arranged this webinar, and there needs to be more education, and we do as a hospital, as a stroke program, we do year-round community education, community awareness, because we would like you to come right away to our ERs, and we would like you not to have a stroke. So please know your risk factors and address them, and follow your primary care physician as well as other doctors.
And I would like to add, since it's the Stroke Awareness Month, you be the hero also in the community. Spread the word, spread the BFAST, the meaning of BFAST, the meaning of Rapido as well, because you can also save someone else's life. And you are not alone. We are here for you, and all the resources we are going to provide to you. So be a hero for the stroke and spread the word.
This concludes our BFAST for Stroke webinar. A special thanks to our panelists, Nurse Practitioner Harriston, Dr. Rafiq, and Senior Nurse Educator Luciana Castro for sharing their knowledge. To our attendees, thank you for your time, and we hope you are leaving a little more informed about the signs and symptoms of stroke and effective lifestyle changes to reduce the risk of stroke. Be sure to follow us on Facebook, where we will post a recording of the webinar for you to review later. Until next time, goodbye.